Good afternoon, I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then take action to try and make a better system for all of us. Before I get started, today's stories are mostly related to cancer and new treatments. But before we get started, down below in the YouTube description box, you'll find a link to the Healthcare Advocacy newsletter that is the text for today's video. It has all of the background material, a lot of references, links to news stories, and medical academic reports as well. So let's get started. Let's first talk about cancer treatment news. Two new studies led by researchers at Washington University School of Medicine in St. Louis have identified a possible way to block the progression of several forms of blood cancer using a drug that's already in clinical trials against breast cancer. So that's good. The studies were both conducted in patient samples and animal models. So this is really good because they used humans. They found that inhibiting a protein called RSK1 reduces inflammation and stops the progression of blood cancers called myeloproliferative neoplasms. Say that 10 times fast. We'll say MPN, as well as an aggressive form of acute myeloid leukemia, AML. With RSK1 inhibitor already in clinical testing, the path to expanded use as a treatment for blood cancers likely will be accelerated. Now, in humans, MPNs can be slow-growing blood cancers that simmer for years. Doctors can monitor the disease and sometimes treat symptoms, but there's no reliable way to cure it or slow it down. Patients with MPNs are at high risk for developing a secondary AML leukemia that is very aggressive, that has no effective treatment. Patients with chronic MPNs can live with the disease sometimes for decades, but they are at risk, as I said, for developing a secondary leukemia, which has poor prognosis, said Stephen O., who is a doctor and a PhD, and an associate professor of medicine and co-director of the study, and he's in the Division of Hematology at Washington University. According to him, these patients have no effective medical therapy, so we hope this new drug will help fill the gap in clinical care. At a minimum, we're hopeful this drug can stop the chronic disease from progressing to AML, give the patients a chance to live. But the goal is to eliminate the disease and get patients into remission. If you go to the newsletter, there is a link to each of the studies that they published. One was, I believe, January, and one was last November. They are in Nature Communications and the Blood Cancer Journal. Okay, let's talk about women in cancer, because deaths are down, but incidence is up, and so there's a lot of room to improve. The American Cancer Society released its publication, Cancer Statistics 2025. Of course, there's a link to it in the newsletter. It's the organization's annual report on cancer. It's facts related to it and trends, and they have some supplemental graphic material that I've also included in a separate link. The new findings show that cancer mortality rates have declined by about a third, 34%, over the range 1991 to 2022 in the United States. Now, that saved about 4.5 million deaths. However, the steady progress is jeopardized by increasing incidences of many types of cancer, especially among women and younger adults, so it shifts the burden of the disease. For example, the incidence rate in women aged 50 to 64 have surpassed those in men, and the rates in women under 50 are now 82% higher than in male counterparts, up from 51% in 2002. The pattern includes lung cancer, which is now higher in women than in men among people younger than 65. Look, less smoking, better treatment, earlier detection, they all help fuel survival. The progress, though, is tempered by rising incidences, as I mentioned, in young and middle-aged women who are often family caregivers, and shifting cancer burden from men to women harkens back to the early 1900s when cancer was more common in women. I didn't know that. Did you? Anyway, overall in 2025, there's going to be an estimated 2,041,910 new cancer diagnoses in the United States. If you're keeping track, that's 5,600 every day. And 618,120 of those will die. There will be cancer deaths. That's not necessarily the ones that were identified. So 618,000 deaths, a little more than 2 million new diagnoses. In addition to projecting the contemporary cancer burden, though, the American Cancer Society researchers compiled the most recent findings on population-based cancer occurrence and outcomes using incidence data collected from the Central Cancer Registries and mortality data that's collected by the National Center for Health Statistics. The first one is through 2021, the second one through 2022. The third highest cause of cancer death, by the way, is pancreatic cancer, and there the results are still not good. The 5-year survival rate is just 8% for the 90% of those people that are diagnosed with pancreatic exocrine tumors, and that's almost 90% of them, so it's not good. Other highlights from the report: despite the overall decline in cancer mortality, death rates are increasing for cancers of the oral cavity, pancreas, uterine corpus, and liver, female. Additionally, alarming inequalities in cancer mortality persist, with rates in Native American people 2 to 3 times higher than in white people for kidney, liver, stomach, cervical cancer. Black people are twice as likely to die of prostate, stomach, uterine corpus cancers compared to white people, and 50% more likely to die from cervical cancer, which is altogether preventable. Incidence rates continue to climb for common cancers, including breast, female, prostate, steepest increases at 3% a year from 2014 to 2021, pancreatic, uterine corpus, melanoma, female, liver, female, and oral cancers associated with human papillomavirus. The rate of new diagnoses of colorectal cancer in men and women younger than 65 years of age and cervical cancer in women 30 to 44 years of age also increased. This is not good. Cancer incidence in children 14 years of age and younger declined in recent years after decades of increase, but continues to rise amongst adolescents age 15 to 19. Mortality rates have dropped, though, by 70% in children and 63% in adolescents since 1970. This is largely because of improved treatments for leukemia, which is apparently what they get most. Progress against cancer continues to be hampered by striking wide static disparities for many racial and ethnic groups, said Dr. Ahmadin Jamal, Senior Vice President for Surveillance and Health Equity Science at the American Cancer Society, and he was the senior author of this report. It's essential to help end discrimination and inequality in cancer care for all populations. Taking this step is vital to closing this persistent gap and moving us closer to ending cancer as we know it for everyone. Overall, the report highlights the need for improved treatment, early screening, and of course, better access to medical care. How can more people have better access to early screening and treatment and possibly survive? Well, I'm glad you asked, because the answer is universal health care. It could do that. Recall that we saw in the UK last week, and there's a link to my report on that, they have implemented improved widespread screenings, and now more cancers than ever are detected so early, stage 1 or 2, that survival is much more likely. We could have that in our country as well. Now, while you're thinking of it, remind your legislators, here's the action, that increased cancer survival is in everyone's best interest, and that universal health care can do that. You can reach them. I'll put the link in the YouTube description box, but it's as usual, www.usa.gov/elected officials, elected-officials, or my favorite way, on your cell phone, send a text message, sign SIGN space PZGOUD to 50409, 50409. sign PZGOUD, and you'll send a message to the President, to our senators, members of Congress, governor in your state, and your state legislators. I'll read it for you. I'm your constituent, and I learned that the American Cancer Society just released their 2025 statistics on cancer in the U.S. Here is a link to the report for you. I include it because maybe their legislative analyst will look. They found that while some cancer deaths are declining, the number of people being diagnosed yearly is on a sharp rise. It's expected that 5,600 people will be newly diagnosed every day, 7 days a week, and that it'll kill more than 618,000 of us this year. To improve survival, they recommend better access to care, and that includes pre-screening, which means better primary care for everyone. What does that is universal health care. Now, the 118th Congress had a bill to do that, H.R. 3421. Here is a link for them to the text of that bill. That is exactly what we need because it will increase access with regional directors making sure that care is available, and with global budgets making sure that facilities can stay open and pay staff. 62% of Americans want universal health care. That's according to a National Institute of Health publication, and you should pay attention to what your constituents want and need. P.S. Here's that link to the National Institute of Health study so you know it's for real. That's what I have for you today. Down below you can like, share, and subscribe. You can contact me here on YouTube or at healthcareadvocacy1@gmail.com. Have a good evening.